Good morning. Arthritis classification, major arthritis, very common form of arthritis is osteoarthritis. So we will see in detail all everything about osteoarthritis. And then we will move on to infectious arthritis. Immunological disease is mainly rheumatoid arthritis. Okay. Arthritis induced by crystals. There are two, gout and pseudo gout, formed by crystals. And certain arthritis which are associated with systemic disease like psoriasis, GI disease. So we will briefly look into arthritis associated with systemic disease. Okay, so osteoarthritis is a very important topic. It's very important to know everything about osteoarthritis because it's very, very commonly seen. About 80% of all elderly people suffer from osteoarthritis. Osteoarthritis is a degenerative disease, which means there is itis in the name, okay, but it's a misnomer. There's not much of inflammation happening in osteoarthritis as the name says. Okay, it's a degenerative disease, okay, characterized by progressive erosion of articular cartilage. So we just now saw that how articular cartilage acts as a shock absorber within the joint space. So this shock absorber, what is the lifespan of it? Okay, as we age older, this articular cartilage also goes through lots of wear and tear, and it will start to degenerate. Okay, it's just wear and tear due to degeneration, due to long-term usage. So there's not really a inflammatory process happening here. Okay, so that is the main pathogenesis of osteoarthritis. It's just a degenerative disease. And it can be classified as primary or secondary. As you might expect, primary is just wear and tear. There is no any real cause, any predisposing factor other than old age for primary osteoarthritis. So most of the arthritis are primary. Okay, primary, otherwise idiopathic, seen in elderly. As you might expect, most commonly affected joints are the weight-bearing joints. So they are the one which has been working hard through decades, carrying our weight, like hips and knees, and very common in overweight individuals. Okay, although interphalangeal joints may also be involved, most commonly involved joints are the weight-bearing joints. And there are certain individuals, certain families which are more affected by this disease because of mutation in gene which is responsible for the synthesis of type 2 collagen. So type 2 collagen is an important component of cartilaginous matrix which acts as a shock absorber. So if this gene is mutated and this gene is carried in families in a Mendelian pattern of inheritance, then these individuals are more prone for getting osteoarthritis during their lifetime. Is secondary osteoarthritis, very small percentage of the patients where you know the cause of the degeneration. The degeneration is because of a known cause such as trauma or an immunological joint disease or a crystal-induced joint disease or even infectious joint disease or acromegaly where because of excess growth hormone the bone ends are bigger and there is a lot of friction when the joint moves, or iron deposition, or because of a deformity like partial dislocation or subluxation of a joint. So we basically know the cause. There is an underlying disease which damages the joint in secondary osteoarthritis. Okay, pathogenesis, as I explained, is nothing but aging and wear and tear over a period of time, like over many decades joint has been like working hard, and so there is wear and tear and that causes degeneration. So that is the main pathogenesis, and there are some genetic factors where mutations are inherited. And what happens over a period of time is the changes in composition and mechanical properties of the cartilage. As I told you, increased water means less shock absorption. It's also decreased proteoglycans or collagen, also less shock absorption. And increase in cytokines or metalloproteinase. Remember we talked about enzymes and proteinases which maintains a balance in the production of matrix, cartilaginous matrix. So when there is an imbalance, that is a main pathogenesis in osteoarthritis. So imbalance is when there is more water and less of collagen because of all these inflammatory cytokines or because of the protease enzymes. When there is a imbalance between production and degradation of the collagen, then that is a reason for degradation of joints, joint cartilage, and that can lead to osteoarthritis. That is the main pathogenesis. So if you see this, this is a end of the bone, and this part is the part of the bone which is inside the joint space, and this bone is covered by cartilage. So this shiny thing which you see is the cartilaginous cap. So this cartilage and the matrix produced by this cartilage is the one which provides the shock absorption. Okay, so when there is a joint and there is two bones meeting in a joint, and when the joint moves, okay, because of the cartilage protection, the cartilage which is covering the ends of the bones provides shock absorption when there is movement in the joint. Imagine if this cartilage is degraded, okay, over a period of time because of wear and tear, this cartilage is degraded. What happens when the cartilage disappears? The underlying bone becomes exposed to this friction when the joint moves. So when a bone brushes against another bone, there is going to be irritation there. Okay, so here if you see, this is osteoarthritis where the cartilage is gone, degraded, and the bone surface is exposed to all the friction when the joint movement happens. So this is osteoarthritis case.